So I'm Dr. Martin Rutherford, certified functional medicine practitioner, chiropractor, forever.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So the title of this is what makes us different dash Power Health Reno. So for those of you who've watched us, we're not fond of marketing. We're not fond of the websites of like, hey, look at us and here's what you do for fibromyalgia, and it involves taking our 8 supplements and all that type of stuff. But so this is a little bit of a I don't want to say uncomfortable, but this is something that we're doing for a different reason. So it may come off as self-salutary, or it may come off as marketing, or whatever it is. But here's what it's intended for. We have a lot of patients that call us from all over. We have patients that call us literally from all over the world, certainly all over the country. And one of the first questions is, they'll usually say, I've watched several of your videos. It feels comfortable, feels like you guys know what you're talking about. Is there somebody here who does what we do? I wrote an entire essay that's online about why we don't refer to people around the country who are functional neurologists, are functional medicine doctors. So that's going to sound like, hey, look at us, we're like the greatest thing in the history of the world. But the reality is we have referred on many occasions, and it's really never turned out well. And there are a variety of reasons for that. So, you know, we've referred these people, whether it was to LA, whether it was in North Carolina, whether it was in England, wherever it was. And then these folks were in networks that we were told they were trained up and they knew what they were doing. And then we'd get a call from the patient. Frequently, the patients already paid a lot of money to someone who we get the call, and it says, Dr. Rutherford, I mean, I don't know how to tell you this, but, you know, they're not doing what you guys are doing, and on and on. And we kind of sort of know that, but we kind of also assume there are people out there who know what they're doing. But it's kind of dicey when we send somebody out. It's a referral. It doesn't go well, which has been every time we've sent somebody out, pretty much. It comes back on us. So why have we stopped referring to other people? What makes us different? This would also maybe morph into, you know, why are we feel comfortable taking cases, or why are we getting results in cases that maybe people along the way aren't getting? Again, that's not something beating our chest. It's just that everybody that comes here has been now. It used to be they've been to their medical doctor and they didn't get better, and they wanted something alternative, and they happened to wander into our office or something. I mean, like talking like 8 years ago or 9 years ago or whatever. But now it's more, you know, I went to the medical doctor, they weren't listening to me, I'm getting worse, I'm taking the pills. I went to this practitioner, I went to this alternative practitioner, I went to that alternative practitioner, I went to this alternative, this functional medicine doctor, this functional. And, you know, somebody told me to come here, but I mean, I've already been to functional medicine, and I've already been to functional neurology, and it didn't work. So I don't know, what is the you guys are going to do for me? So that's what this is about. So that's what this is about. This is what makes us different, I think, is really kind of sort of answered by, really, functional medicine was meant to be a systems-based approach, which is what we do, which it's more thoughtful. There's a little bit more, there's actually a lot more critical thinking going involved. You're not just getting an adrenal stress test and going, oh, you have like DHEA highlighted, so let's give you DHEA or something like that. And functional neurology, by my observation, is a very difficult discipline. It's not easy to go, even if you take 500 or 600 hours worth of courses. It's not easy to come out and start changing people's brain function with exercises, although the internet might make it seem so. So a lot of the doctors that I knew, I don't think I ever knew a functional neurologist before I met you, and I knew a handful. Well, that's not true. That's not entirely true, because a couple of the guys that were in the functional medicine thing were there. But most of the ones I knew before that came out and they weren't doing anything like this, even though that's what they were being taught. So hard for them. They started just doing exams and doing general exams for courts and what they call independent medical exams and stuff like that. So just because somebody's a functional neurologist or a functional medicine doctor doesn't mean In fact, it almost means like you're not going to get the same thing from any two people that you go to. So it's kind of the general lay of the land and we do it, I would say, kind of the way it's meant to be done.
And that's a good point. And that's what I want to go to next. Because when you were a kid, you described your experience going to the doctor.
Well, yeah. Well, I will tell you what a good doctor was that made you want to even go to that person. Was he takes time with you and he listens. Almost never like, oh, does he get you better? But yeah, and I had an experience when I was a kid when I had mono, and I went to doctor after doctor after doctor, and then finally my dad took me to this older doctor who was about 84 years old, and the other doctors, a couple of them, it was like still of the age where they were starting to blow me off, and I'd go in and I'd be so massively disappointed. I'd go in, they'd do a cursory exam. So my dad took me to this doctor, and he was an older guy. He was in his 80s. He was close to the end of his career, and basically, I waited like an hour and a half in line in a city street just to get in his office. And then about another hour, just to go from one seat to the next, 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 to get into his office. And then I got in there and I found out why. It was because he sat there, he listened to me. And after having gone to 2 hospitals, a couple of docs, he figured out what was wrong with me. And I said, how did you figure out what was wrong with me when nobody else figured out what was wrong? He says, well, doctors are starting to lose their abilities. He said, but if you sit there and listen to the patient long enough, the patient's going to tell you what's wrong with them. And sure enough, he was right. Now, having said that, you have to have a relevant understanding of the terrain that you claim to be an expert in, which in this case, we're talking about chronic pain, chronic diseases, autoimmunity. We're talking about, and that's a complex case, but there is a relevant history, and it's not, and frequently it's not taken or it's not done. So one of the things you have to do is know the field you say that you know, which may sound silly, but most of the people who are doing a lot of these chronic problems have no clue really what they're doing relative to really addressing a chronic problem. So we have a relevant history that we've built over the years and have fine-tuned. And one uniqueness for us is Dr. Gates does an enormous amount of research. So continuing to fine tune, and we'll get people that'll come in here who are in the field, and they're like, "Wow, where did that come from?" I say, "Well, it came from the medical literature, but it hasn't gotten out yet into a part in the world where it's actually being used." So, but in general, you need to have somebody who understands what's wrong with you. Do a history. A lady came in yesterday, and she had an interesting problem, and she started spitting out at me very quickly. Okay, I'll get this out very shortly. And I stopped her. I said, I don't want shortly. We've scheduled 45 minutes for this. I want to hear the whole thing. And the change in her demeanor was quite a bit. But that's what it takes to figure these things out. You have to be a detective. And so I think one of the things that we do that is different is we schedule differently. We're a couple of weeks out on even putting a new patient in, because we only see so many patients. Because you can only do this type of work, you can only see so many patients and do a good job and be all over all of the moving components. And we schedule an hour and a half examination, 45 minutes for the initial history. One of the things that makes us unique is we screen patients.
True.
Yeah, we screen patients. True. So we don't recommend care to everybody. We understand what we can do. Now, when I say that, I get a lot of patients who come in here. I do the intakes, as Dr. Gates said, so I hear all this. So we get a lot of patients that come in here, and they've been to a lot of doctors, and mostly they have left them because they started to get the feeling that the doctor was just trying one thing, or they'll come in and say, and then my doctor said, I went to a great new seminar last weekend, and I got a new test. And by that time, the patient is starting to understand that the doctor never had a game plan from the beginning, never really understood their case, was kind of winging it, treating by the test. And you probably all know what the tests are. It's the big blood test now that everybody's doing. And you get a supplement for everything. And it's the adrenal stress index test, and it's the heavy metals test, and it's the hair analysis test.
So that's a good point, because one point we have down is no standardized testing. So the testing is very specific for the patient's issues.
Yeah, I think that's really important. Dr. Gates has worked hard. I don't know if I sound like I'm like a fan. I am. Okay. So when Dr. Gates came here, one of the things that he embraced was that diagnosis and examination and diagnosis was the key. Now that sounds obvious. Okay. But to those of you who are watching, a lot of you probably don't have a definitive diagnosis at this point in time. And so we were sifting back then, doing lots of expensive autoimmune tests, which turned out to be pretty inconsistent and unreliable, and on and on and on. And then we found a gut test that was good, and then it wasn't because they changed the way they did it. And you have to even be astute enough to figure that out. But Dr. Gates has taken our clinical diagnosis, I think, to a new level, because when we're evaluating patients, I mean, we can communicate with Stanford or UCSF or UC Davis. For those of you who are not here, those are the big facilities on the West Coast, with our diagnoses, and we get good reception because they understand that we understand pathological diagnosis, infectious disease diagnosis, but that our diagnoses for autoimmunity make sense. And I would like to say we don't do that much testing, because once we've done the history, and this is hard for people to understand. I had a nurse yesterday. It was just, she could not completely get in sync with this because she was looking for a test, lab range that would tell her specifically what was going on. And but Dr. Gates has done a lot of research on all of these things, to where in the old school, to go back to the gentleman who was 84 years old, you take a good history. If you know the field that you're in, you start taking good history, and let's say a person's got peripheral neuropathy, all right, pain, numbness, things. There's 85 different things that cause that. By the time you've taken a good history, just the history alone should get you down to like here, to maybe 5 or 6 things. And people aren't doing this. And nobody's doing this that I know of. People are not taking good histories. Then you do the examination. And we have an hour-and-a-half examination that we put together. It's a very classic examination, except we do it. And it's very thorough. It's an hour-and-a-half. And then between the findings from that exam and the findings from that history, frankly, in most cases, you should know what's wrong with the patient. So the testing that you should do should be more to help them to get better. Now, there are going to be cases where you're to that point and you don't know what's wrong with the patient, but you've still narrowed it down quite a bit. And then you do the testing, and then that's the last bit of piece to it. What makes us different is most people give you a little 2 pages. For those of you who are doing phone stuff and you're not even showing up at the doctor's office to get a real and thorough evaluation, and you're not getting an exam and everything, to me, that's crazy. Okay, knowing what you can glean from an examination. And so you do the exam, you do the history, and then the testing should be very efficient, and it should be the hard data and the good data that you require. And then you can execute these very complex cases because you have all of the data there, instead of okay, I got this, I did an intake form, which is 2 pages long. And what are your symptoms? Okay, we're going to do all this test. And then you're going to go off the test. What makes us different is there's a logarithm that has developed here for that. No, in English, basically a very organized way of understanding how to go about these conditions, these chronic conditions, where dizziness, vertigo, balance, whether it's chronic fatigue, fibromyalgia, peripheral neuropathy disease, Lyme now has exploded on us in our practice. And there's a very organized way of going about it. That's what makes us different.
Organized treatment flow.
Organized treatment flow. Dr. Gates does all of these treatments. And so it starts in a certain way, but it can only start after you have the data. I hate to keep pounding this, from a thorough history, relevant history to your problem, a thorough exam, the proper testing, and now you have a picture of that person's neurology, their physiology, their immunology. And now you can actually say, okay, here's what we have. Where do we start so that we can execute in an organized fashion so that we're not guessing?
Mm-hmm. And to create a relevant prognosis at that point.
And
because we have seen thousands of patients. We've seen thousands of patients. So our ability to predict now is pretty good. Are we perfect? No, but our ability to predict is very, very high, which you can see via our testimonials, which we just started recording in the last 1.5 to 2 years. And our success rate is high because we're pretty good at predicting who's going to get better and who's not. We're realistic with patients. If someone comes in here with a certain type of peripheral neuropathy that's genetic, they have a lot of weakness, we'll let them know that weakness is probably not coming back. But we have seen other patients
but the
like
other
you.
Things can get better.
Yeah, your balance can get better, your sensation can get better, the numbness can improve based on our experience. So we give patients those realistic prognoses, and patients really seem to appreciate that.
Because they don't get it.
Right.
Because when a patient comes in here and sometimes you can tell the first day, but the result of the way it's being done out there, and this is our experience of having sent a couple dozen people out a long while ago, and it was just like, okay, we're not doing this anymore. The result is patients show up here and they're shocked when I say, oh, well, this is probably about a 4.5 to 6 month case. And we're not sure yet, I'm not sure what the specifics are, but just from your history, this can probably get better. This can probably get better. This is iffy. We'll know more after we do the exam. This we may not be able to take care of, so on and so forth. And people are sitting there like in shock because nobody's ever given them a prognosis before. Now, this goes back to old school. Okay, old school. We're kind of old school diagnosis, but we're kind of new school treatment. But old school diagnosis has been around since Hippocrates. Do a good history, do a good exam, then do the testing. And you should know within 2 to 3 differential diagnoses what's wrong with somebody. That hasn't changed really, but it has changed because nobody's doing that.
And by that, it's important to highlight that the insurance industry has changed the landscape in healthcare in large part. So the landscape in healthcare has gone away from the doctor having all this time with the patient, the time that they needed, to where doctors, as many of you know, have 10, 15 minutes with you, and they have to get in and they have to get out and get on to the next patient.
Have to take their notes so that their notes are
contemporaneously,
within 24 hours or whatever it is.
Exactly. And so because of that, many of you feel blown off, you're disenfranchised. And what Dr. Rutherford has set the tone here for is for us to arrange our schedule so we do have the time. We have an hour and a half. Frankly, lots of times we run over in that hour and a half because it just takes more time. We have people flying in from all over the world, and that we cannot underemphasize or overemphasize, the importance of that diagnosis up front, because that's where it's all, the whole treatment is based on that. And that's where we come up with our cost-effective testing. That's where we come up with the lack of a standardized treatment protocol. Even though we have a general framework, it's like a tree that you're going down. The trunk of the tree is pretty much the same for everybody, but then we branch out heavily from there.
Yeah, and the prognosis is important because it's an endpoint. People have been going through some of these chronic fatigue, fibromyalgia, Lyme things for years and years and years and years. And if you can say, look, it's going to be 4.5 to 6 months or 9 months or whatever, we rarely have a 9-month one anymore, but occasionally. So if you can say that, and you can say, here's what you can expect. Okay, and we do hit it most of the time, but as Doug Gates said, not 100% of the time, but we do hit it most of the time. And here's what you can expect. And by the way, here's what the costs of the program are going to be. I think one thing that I feel like it differentiates us is now functional medicine. Most people know, and they come in, they sit down, they go, I know insurance isn't going to cover this. So, well, we take that very seriously. And so we don't want people starting this. I actually think this differentiates us. I don't want people starting care. This is my responsibility, doing the initial consults and the Skype consults to the people who are out of state and out of country. I don't want people starting care who aren't going to get better, who don't have a substantial probability of meeting or exceeding our prognosis. So there's no open-ended, we're going to be doing this forever. And for those of you who've never seen this, I've been through this as a patient. Okay, I've been through this. And it's kind of discouraging. It's like, okay, we'll take these supplements, and then that didn't work. Okay, now we'll do a sauna and colonics, and then, oh, that's not working. Let's check your hair. Okay, now I check my hair. Now we got heavy metal, so now I'm in 35 chelations and so on and so forth. And that I know it's the adrenals. Well, it's your thyroid. Let's do zinc. Oh, that's not working, and so on and so forth. So it's not like that. Okay, it's very organized. But the point there is, we're very sensitive to the fact that insurance doesn't pay for these things. There's nothing we can do to get insurance to pay for it. Okay, so it's not us. So we don't want people coming in here, putting their hard-earned dollars in here and spending their time and effort only to be disappointed again and not get something in return and value for their investment. So I actually think that makes us different, just based on the stories I hear time and time and time again for people who come in here, how much money they've spent, and the fact that a lot of times they stop with the current practitioner because it's getting expensive, and I was feeling good for a while, but now I'm not feeling good, and now we want to do a lot more tests, and it's a new test, and I'm just not sure it's going anywhere, and that doesn't happen here. That's what makes us different. Now this is starting to sound like a sales pitch, but these are the things why they'll call, they'll talk to my staff, and they'll ask them, hey, listen, our staff and can you send us here? And people will say, well, no, we're not going to refer you anywhere because we're not sure if you're gonna get something that really is going to be valid enough to get your type of a condition to some point where you're going to feel good about this referral or the money that you're paying them. So I mean, I think that makes us different. Organization makes us different. Having organized game plan makes us different. What Dr. Gates does, when you're treating like let's say it's a systems-based approach, okay? So pretty much it's not a symptoms-based approach, and it's not even in many cases, not even technically kind of a specific organ-based approach. You have nervous system, a cardiovascular system, you have a gut system, you have an immune system. We evaluate, we try to find out what the systems are that are involved, and then pick out the one or two that look like these are the guys that are going to be the ones, because all 9 of your systems in the body are trying to be in balance, okay? In balance. So balance is where it's at. So one or two of them goes, the other 7 have to try to make up for it. If these 2 are bad enough for a long period of time, the 3rd one goes, and so on and so forth. We'll hit those systems that seem to be the ones that are linchpins, and you might see everything else get better, or you might see most things get better, and then maybe there's a couple that didn't. Now you can concentrate on that, and it's an extremely organized approach based on the fact that all the data has been gathered in the early part of you executing the case.
Right.
So there's no, it's not like it's a guessing thing. It's like, okay, I hit this wall. Now you look back at all the testing and go, okay, this part of the testing indicates we should go this way now. I mean, simplistic, but that's what you do.
And then within those systems, the 2 major systems are the brain and the gut. And the brain is our primary focus. That's what we've realized. We've come to the conclusion of that after, I think you're coming up on 9 years of doing this. I'm coming up on 8. And we've tried it all, as Dr. Rutherford said, and we've just found that the stress response cannot be, again, appreciated enough relative to chronic pain patients and autoimmune disease, childhood trauma, PTSD. So one thing that makes us different is that fight-flight response that many of you don't even realize you're in until we start talking about it, asking if you have heart palpitations, or if you have chronic urinary tract infections, or you need to pee all the time, or if you get butterflies in your stomach, you have IBS, or if you can't sleep, and all of those symptoms, those have to be taken care of before we really start to address other facets. And I think one of our main mantras that patients appreciate is that less is more. We're not into a gazillion supplements. I almost feel bad when I have patients on 7 supplements. In a lot of alternative practitioners, you walk out of there with 2 bagfuls of supplements. But we try to be very targeted with our supplementation, because in all reality, if you fix the brain, a person shouldn't need as many supplements. They shouldn't need as many gut repair supplements. They shouldn't need all these other supplements. And then if you're fixing the brain, you can actually fix the gut, which calms down inflammation throughout the entire body. So people's mitochondria heal, their Epstein-Barr virus infections calm down, their adrenal glands actually have a chance to catch up and to heal. And by doing that, we've kind of created this paradigm of, well, it's not we're actually following the functional neurology and functional medicine paradigms. Unfortunately, a lot of practitioners out there are saying they're doing that, and they're really not. And it's really,
and we put 2 paradigms together, doing them the way they were meant to be done.
Whereas most people now saying that they're doing functional medicine because it's a buzzword, are actually doing alternative medicine, which is a vitamin or a supplement for a blood test for a symptom rather than a pill for a blood test.
And the paleo diet.
And the paleo diet.
And the reason that we can do the neurology, the brain, is because the functional neurology world, which is not a large world, okay, that's what they do. All right, their discipline is getting your brain to start functioning normally, preferably without any drugs, with exercises, maybe with some nutrients borrowed now. I guess they're doing it now from the functional medicine world. But in reality, as I stated before, if there's 500 or 600, I don't know how many there are, board certified functional neurologists, I don't know, small percentage of them seem to have been able to assimilate the data and the protocols enough to be doing what Dr. Gates is doing. And that's, again, it's not a sales pitch, it's just the way it is. Okay, so these are difficult things to do. And so we've been able to change brain function instead of using Xanax and Prozac and benzodiazepines and everything else you could possibly imagine, and get brain function to change, and then complement that with the functional medicine approach. And it's a very unique approach from that perspective. Now you're going to hear people say, I do brain work. Well, they mean they're giving you adaptocrines, which are basically for everyday stress, not for like post-traumatic stress syndrome, fight-flight syndrome. Maybe they have magnets that they're putting on the head. They're doing that because they haven't bothered to go and understand or take these courses and do it. And so maybe you'll get a little bit of a temporary bump for a couple of weeks or so, 3 or 4 or 5 or 6 weeks, and then it'll go away and then it'll come back, and you're not doing it. It's just, there's so many bits and pieces out there, not just on the internet, but in the clinical therapeutic world, that everybody wants to get in on what the new fad is. It wasn't a fad. Okay, chronic fight-flight, post-traumatic stress syndrome as a common entity now is not a fad. It's a big problem. Autoimmunity, we were just talking about before we went on here, is not a fad. Even the celebrities are now starting to talk about it. Gluten is not a fad. These things are not a fad, but they're not being learned the way they should be in general. They're not being understood as to how they intersect, because it takes critical thinking. And with all due respect, you know, critical thinking is not what's being taught at these seminars. We know because we've been to them all. It's being taught, here's your adrenal stress index, here's your gut thing, here's your hair thing, give this for that, give probiotics for this, put people on the paleo diet. And probably the biggest thing that helps all those people's patients is getting on the paleo diet and getting off of grains and really getting off of gluten. Mm-hmm. It's usually like that, and the person feels better, and then they don't, because all these other things are still going on. Exactly. So I think that's what makes us different. And there are people who are trying to put these protocols together in a postgraduate program to teach what we're talking about. We'll see how that works. So but if it works, you're not going to see these doctors for 5 or 10 years, but that would be great when we start seeing them. So those are many of the things that make us different. Mm-hmm. As far as why to go back to this, as to why this video is going to be used to show to people who call and say, why can't you make a referral, you know, for me? And so really that's the essence of this. This is going to be used on our private website to answer that question, along with that little short-term paper that I wrote on that. And so these are the things. I don't know, other things. Less is more, less is more, less is more, less is more. Less supplements are actually better for most chronic pain patients. Well, how do you do, I'm sorry. How do you do that? You do that by doing a good history, doing a good exam, knowing your subject, doing a logarithmic type of a presentation in which things are going to be organized as you go along. You're able to give a person a specific prognosis, a time element. You can even give a person pretty much, we can give patients our fees up front. In fact, I'll tell you what makes us different. The person comes in, they get the history, they get the exam. Dr. Gates actually, if there's neurological components to their chronic pain, which there usually is, Dr. Gates actually does an extended exam in which he does some of the exercises. And he does some of the stimulations and strategies that he has determined from the examination to be things that need to change for this person to get better. So he'll actually treat them as kind of a mini treatment, an extended exam, to make sure that their nervous system will either work, will respond to what we do, or that he can tell them, okay, you didn't get much of a response today, so that means you're gonna have to do a lot more exercises. But we can tell people that up front. We summarize it in a report, and it's a report that if the patient decides to become a patient, okay, and I'm gonna emphasize that in a second, then, and they get a copy of this report. It's a report we use with the medical profession to communicate to them if we need to get them off of medications, or even to go to another point, we're not anti-medicine. We are for what works. 95% of our treatment is probably not medical, okay? And 95% of our patients, but if we need certain tests or MRIs or CAT scans or things of that nature, or if we need a person to help us to get people off of medications, or send people to a psychiatrist or whatever, they might get a copy of this report, okay? But the thing is, you get a copy of it. I review it with the patients, and once we reviewed that with the patients, we can now say, okay, here's your prognosis. Here, you can see why, based on your history exam. I just went through it with you, where we got our opinions from, and here's what the testing is gonna be, and here's the cost of everything. And then the patient decides whether they wanna do it. If we recommend the treatment, they can look at that, they can look at the fee and say, okay, I think this is a fair fee for what you're claiming that you're going to be able to do for me. So I think that makes us, kind of different, okay? So our patients get used to this. And then if they move and we send them somewhere else and then it's drastically different, we get a phone call, because they're loyal to us, and it's kind of like, whoa, it's kind of like, you need to know, not send anybody here anymore. And after so much of that, we stopped doing that. And this is why. And this is why.
Yeah, I think this summarizes it.
Yeah?
Yeah, I do.
You have anything else to do on all the magic that you do out there?
We hit all the main points. Those are the main factors. Okay. Exactly.
So that's what makes us different. And if you find people out there who are doing this, let us know and we'll refer to that. Okay. We'd be happy to. We actually would be happy to. That would be just fine. So so please let us know if that's something that you find that is congruent with somebody that you've been going to out there. And that would be a nice thing for us to know. So that's what makes us different. That's why in general, we don't refer anymore. And I hope that is, I hope that satisfies your kind of understanding of why we don't do that. It's not that we don't want to refer. It's just that you often ask, is there somebody that does what you do? And the answer to our knowledge is no.
Exactly. Yeah, that's the answer.
Yeah.
Okay. Well, thank you for watching. We'll be back next week with an exciting broadcast. And if you have any topics you want us to cover, I know that some have asked about hypertension. We haven't forgotten about that. We did a whole series on Lyme. We'll probably be talking about autoimmunity, concussion coming up in the future, something that I would like to get back into, and brain injuries. But let us know and we'll try to cover it. So thank you for watching, and we'll see you next week.